Hello and welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Thanks for joining us. The global count of confirmed cases of COVID-19 is now over 193 million, roughly 500,000 a day this week. And as at Friday, July the 23rd, the death toll was over 4 million. In Nigeria, there were more than 170,000 confirmed cases of COVID-19, more than 164,000 recoveries, and 2,131 deaths. There were 1,417 new infections, 124 recoveries, and 5 deaths recorded in the week leading up to July the 23rd. That's a lot of infections in 1 week. Recovery rate has dipped again to about 96.6%. Case fatality is about 1.25%. Tested samples are over 2.4 million. Hepatitis is our topic for today, and it's an inflammation of the liver caused by infectious viruses and non-infectious agents. Main strains range through types A and E, but Hep B and C usually lead to chronic disease in hundreds of millions of people. According to the World Health Organization, about 354 million people live with hepatitis B or C worldwide. My guests are President, Hepatitis Zero Nigerian Commission, and Hepatitis Zero Representative to the African Union, Dr. Mike Omotosho, joining us from New York. And via Zoom, that is, and President-elect World Hepatitis Alliance, National Coordinator, Civil Society Network on Viral Hepatitis in Nigeria, Dr. Prince Ada in Abuja. Gentlemen, you're welcome to the show. Let me start with...
Thanks for having us.
Yeah.
Thank you.
Let me start with Dr. Ada. How are these hepatitis viruses contracted and transmitted?
Well, thank you so much for the opportunity to speak about viral hepatitis. As you rightly said, viral hepatitis is inflammation of the liver caused by viruses. And, the liver is inflamed, could be inflamed as a result of so many factors. Toxins could cause the liver to be inflamed. Chemicals could cause the liver to be inflamed. But the one of public health concern is the viral hepatitis, that is inflammation of the liver caused by viruses. And in this context, like you rightly said, we have viral hepatitis A, B, C, D, and E. And it is a disease of public health concern because of the mode of transmission and because of the high prevalence. Now, hepatitis B and C are the two most endemic, if I use that word, and then that causes more mortality and morbidity across the world. Now, for hepatitis B, in fact, it is 50 to 100 times more infectious than HIV. It could be transmitted by an infected mother to her baby, through contaminated needle, through infected blood when it is not screened, and then it's also sexually transmissible, but not much in terms of sexual contact, but unscreened blood and then contaminated needles, sharing of needles, and some unsafe injection practices. These are some of the commonest means by which hepatitis B or C could be transmitted. And one of the major routes of transmission also is perinatal, the vertical transmission, where an infected mother will transmit to her baby at birth. The same for hepatitis C. It is also highly infectious, though it's not contagious, but highly infectious virus. And the mode of transmission is also similar to hepatitis B. And this is a disease that spreads very fast. And unlike HIV, the hepatitis virus could survive even on hard surfaces or dry blood for more than 6 days. The potency of infection could still be very high. That is why it is said to be 50 to 100 times more infectious than HIV.
Let me jump in there and ask Dr. Omotosho. To say that this disease is so many more times infectious than HIV/AIDS, why does it seem not to be receiving a lot of attention?
Exactly. Thank you for the opportunity to speak. You see, like the way Dr. Ada already explained, hepatitis on its own is a silent killer. People do not seem to bother about it because before you know what's happening, it's already eaten into the liver and it's already destroying the other vital organs, starting from the liver itself. You know, I often tell people that the liver is the last man standing, so it helps to ensure that other parts, other organs in the body are working fine. Unfortunately, the strategy now is to encourage people to do what we call the Get 3 TV. That is to get talking about it, which brings me to your question. We need to get talking, let people know how dangerous this virus is. Let me give you an instance. To date, from January 2020 to date, COVID has killed less than 2 million people. And it will shock you to know that hepatitis kills about 1.2 million people every year. Every year. So meaning on an annual basis is second only to COVID. So imagine if you calculate 10 years, how many people will have been killed by hepatitis? And that's why everybody needs to begin to talk about it. In fact, that is the reason why WHO has tagged this year's theme, the World Hepatitis Day for this year, hepatitis can't wait. So people need to get the 3 TV. By getting the 3 TV, I mean first, get talking, get tested, get treated, and then get vaccinated if you're negative. We need the support of media organizations like Channels TV to help get the word out there that yes, there is something that is extremely dangerous and we must find something to do about it. Like Dr. Ada was saying, of course, there are various categories of hepatitis itself, but the popular ones are just 5. Just 5. However, 2 are most dangerous, the B and the C, like you said. The sad part is that the B can actually be prevented because there is a vaccine for the B. And the moment you get the first, second, and third dose of the vaccine, about 1 month apart, you're protected almost for life.
That brings me to my next question. Dr. Motosho, that brings me to my next question. Are all children captured in the EPI? Because I know that the expanded program on immunization has a Hep B vaccine. So if every child gets a Hep B vaccine, shouldn't we be almost out of this problem?
Exactly. Unfortunately, children over 5 are not captured in the national program. That's part of where the problem is. And don't forget that even the EPI that you're talking about started about 7-8 years ago. Meaning any child from 9 upwards probably has not been vaccinated. That's where the problem is. And that's why we need to all begin to talk about it so that we can create that awareness. See, I don't mean to scare people, but it's important for people to understand that 1.2 million deaths annually represents 4,000 deaths daily. For more emphasis, that actually means for the duration of this program, which is about 30 minutes, we're going to be having close to 100 deaths resulting from hepatitis. In fact, further driving home the point means every minute, 3 persons will die of hepatitis. Meaning every 20 seconds, 1 person is dying of hepatitis. It is a serious ailment that everybody needs to begin to talk about.
Okay, let me quickly go to Dr. Ada. Now, these people who are dying of hepatitis, it seems as if it is after the fact that people are discovering that they had hepatitis. Last year, your theme was finding the missing millions. How did that go? Did you find these missing millions?
Thank you so much. Probably, if you permit me, let me maybe add my voice to what Dr. Motosho said with regards to why hepatitis has not really been recognized up to now and the issue of the vaccines. You know, ab initio before now, it's difficult for you to link deaths to hepatitis. You go to an average hospital, you look at cancer, even registers, cancer registers or cause of death of people maybe with liver cancer. It's not, you hardly find data showing people's mortality attributable to hepatitis, chronic hepatitis. But if you go to an hospital, you see that there are deaths attributable to HIV/AIDS, there are deaths attributable to TB, there are deaths attributable to malaria. But before now, so the lack of evidence, the lack of data has contributed significantly towards hepatitis operating under the radar. That's why even policymakers and people don't even recognize that hepatitis is the leading one or the leading cause of liver cancer. So it's only until recently, when data tools have been developed, that there is the evidence is now coming to show that, so most people that even die of liver cancer is attributable to hepatitis. But before now, it goes under the radar. People just die, they say cirrhosis, liver cancer, and it's not always attributable to hepatitis. So that is also a great contributing factor as to why hepatitis has gone under the radar almost globally. Now, concerning the birth dose, let me add my voice to say again, yes, the WHO had recommended birth dose vaccine, that every baby should be vaccinated within 24 hours of birth. Nigerian government introduced the birth dose vaccine like 2008, 2009, but unfortunately the coverage rate is less than 52%. Now, if you go to most rural, semi-urban communities, some women don't even put to birth in the hospital. And prevention of mother-to-child transmission of hepatitis B is one of the greatest opportunities to have children that will be born without hepatitis B virus. Now, coming back to what your question concerning finding the missing millions, that is where we have challenge. Now, like Dr. Motosho said, why is hepatitis a silent killer? Majority of times, people have this disease, but they are unaware, they are undiagnosed. In fact, 1 out of 10 people living with hepatitis have been diagnosed. Just 1 out of 10. Majority don't even know that they're living with this disease that has a potential to end their lives, that attacks the largest organ in their body, which is the liver. So the campaign of last year, Find the Missing Millions, really was to identify people in need of care and link them into care. So the World Health Organization and the World Hepatitis Alliance launched that campaign to screen and diagnose people. But then, unfortunately, most of these things are driven by private sector, by civil society, by NGOs. Hepatitis continuum of care, the simple rapid diagnostic testing of hepatitis is not mostly provider initiated in most hospitals. You go to most private health centers or secondary health centers, you can't find people cannot access free testing. So most of these have been driven by civil society or NGO patient groups, and that is why this thing has not really gone up to scale, because most of the civil societies depend on donor funding from pharma agencies. And so that has really been a big challenge to find people that are really in need of care. Now, that is a huge challenge, because majority of our population that live in rural communities will always come down with liver complications and diagnosed too late. They come down with ascites, community people will ascribe it to witchcraft. The person has jaundice and they begin to so hepatitis also giving different names at the community level. The patient has jaundice and they just say, like in Hausa, they say shawara, yellowness of the eyes, because they lack capacity to diagnose and say this is liver disease, this is hepatitis. They just give different names to it and give that person some few years. The patient comes down with liver complications, with liver cirrhosis and liver cancer, and now that person goes to see the gastroenterologist or the specialist in the health institution, and there's very little they can do because the person was diagnosed too late. So the campaign last year, yes, beautiful campaign, beautiful theme, but we didn't achieve much as a patient group because of the poor commitment on the part of government at all levels, both federal, state, and national, state, and local, to mop and identify people through mass screenings. Most of the screenings were driven by civil society and patient groups, unfortunately. And with limited resources, that cannot really do much in terms of identifying the missing millions of people that need to be in care.
Okay, with that, we'll have to go on a break. When we come back, we want to find out how we can surmount some of these challenges, actually find those missing millions, and make sure hepatitis does not wait. Stay with us. Welcome back. It's Health Matters on Channels Television, and we are saying along with the world that hepatitis cannot wait, and it should not wait in Nigeria. Welcome back to the show. Dr. Motosho, I want to ask you, now that you say test, treat, and get vaccinated if you're negative, and hepatitis can't wait, do we have the capacity to handle all the numbers that these may bring on us in our health centers? How affordable is it to test, treat, and get vaccinated if negative?
Well, thanks. But before I go into that, let me make a clarification. Finding the missing millions was the World Hepatitis Alliance. That's the body for all civil society organizations working in hepatitis. That was a team for last year. The WHO team for last year is hepatitis-free future, meaning we want an hepatitis. Actually, they were targeting the year 2030, so that by the year 2030, all nations of the world will have halted the transmission of this deadly virus. Now, back to what Dr. Ada was saying. I'll jump into your question quickly. He did mention that the basic problem with hepatitis is that a lot of it goes undiagnosed, and that is very true. In fact, we have statistics, global statistics, that is showing that as much as 82 million HIV cases have been diagnosed already. The same way we know that a lot of the COVID cases that we're finding are already diagnosed. But it will shock you that for hepatitis, we have 88% undiagnosed. For instance, in Nigeria, WHO says we have about 27 million people walking around with the virus. And of those, only about 5 million know their status, leaving a whopping 22 million walking around without knowing the diagnosis. The big problem often is that the symptoms of hepatitis are like basic things like body ache, fever, which we call chills, loss of appetite, and maybe yellowing of the stool, which are regular things. And you probably just go to your doctor, and then your doctor says, okay, take this for malaria or those, until there is testing. Now, the issue is, how do we ensure that there's testing? And that brings me to your question. Testing is very affordable. For a cost of less than 1,000 naira, you can actually test yourself even at home. It's possible. And there are organizations that, like Hepatitis Zero, and a lot of civil society organizations under the World Hepatitis Alliance, who actually provide this testing free. For instance, the Rotary Hepatitis Alliance, the Rotary Action Group Against Hepatitis, actually have spots like in Jabi Mall in Abuja, in the Ikeja City Mall in Lagos, where they actually test people free of charge. And you get to pay just for the vaccines. Vaccines that will probably cost you between 5,000 and maybe 10,000, depending on the hospital. They make it available, subsidized at 1,000 naira. Now, what we've done is to first create awareness. You see, when we get talking about this, that's the first leg of the T3TV. We need to get talking. We need the support of media houses to get talking. We've partnered with the National Orientation Agency. Everybody, by the time everybody gets talking about hepatitis, people will know that this is a serious ailment, and then they will go to get it. You know, like people will say, if you think education is expensive, then try the cost of ignorance. If you think you cannot afford maybe 1,000 naira or 500 naira, or even the time to go test for free, wait until you have to treat hepatitis B, or even the cost of curing C, because C, unfortunately or fortunately, is curable, and unfortunately does not have a vaccine, but it is curable. So if you contract any of the two, then you will know the cost itself. So yes, it may appear a little expensive, it may appear a little steep for a country where the bulk of the people live on less than $2 a day, but hey, let's face facts. This is a life-threatening situation. It is a silent killer, and when we all come together, it is possible to actually halt the transmission of this virus and achieve the goal of WHO of halting the transmission of the virus by the year 2030 in an alliance with the SDG Goals 3.3.
Okay, Dr. Ada, let me ask you, is there a program in place which addresses reduction of transmission from mother to child?
Yeah, thank you. The World Health Organization recommended the birth dose vaccination, and again, which is called now the elimination of mother-to-child transmission of hepatitis B virus. So Nigeria signed up to that, and I think the implementation began about either 2009, 2010 thereabout. So children actually are recommended to receive that birth dose vaccine as a preventive measure by within 24 hours of birth. And then that's the monovalent vaccine. And those babies are now supposed to get the follow-up vaccines, which is the pentavalent 4 shots of vaccines within 16 weeks thereabout. But the challenge has been implementation, especially where we have barriers of getting women who, due to either culture or religion or economic factors, are unable to deliver in hospital sectors. And that is where the challenge is. But actually, this is one of the biggest pillars of prevention of new infections. And let me say that the recent statistics by the WHO showed that African region, instead of reducing new infections, African region surpassed the Western Pacific region that initially was higher than us with almost 1 million new infections by 2019 and 2020. And this is because of poor implementation of the birth dose vaccine, which is supposed to be a measure to reduce new infections. Now, the recent evidence is also showing that apart from birth dose vaccine, pregnant women are also supposed to receive hepatitis B surface antigen testing during antenatal. And this is also an area where there's inequity for hepatitis infected mothers. While they go to the antenatal, they are provided free HIV screening, but the hospitals, because there's no funding for hepatitis, they don't have free hepatitis B surface antigen testing, and they have to pay out of pocket. Whereas there is a high risk of a mother that has hepatitis transmitting the virus perinatal vertically to her baby during birth. But because there's no money in hepatitis, no funded program, like government of Nigeria, there's no government program on PMTCT for hepatitis. So women are left to their fate, populations are left to their fate. There's no free antenatal hepatitis B surface antigen testing. And you discover at this moment, infected mothers are still transmitting infection to their babies. So the WHO recommend now that women should be tested at least once for HIV, malaria, syphilis, and hepatitis B surface antigen. And of course, if that woman is tested positive to surface antigen, she's also subjected to another testing, which is the hepatitis envelope antigen, and she could be placed on tenofovir prophylaxis, which is a measure to also reduce the load of the virus and minimize the risk of transmission. So there's a prophylaxis treatment for the mother, which reduces the risk of her transmitting to the baby, and the birth dose vaccine, which is supposed to be given to the baby at birth. But the barrier now is that what happens to women who deliver outside hospitals, who deliver through unskilled community traditional birth attendants or religious homes. So we still have challenge of transmission of hepatitis B outside hospital settings, where those babies are not captured, where those women are not brought to get some services in hospitals. And if you go to some hospitals, they will tell you either out of stock, the vaccines are not there available, or women delivering on Saturday, Sundays, they will tell you the EPI units have not been able to deliver the vaccines. These are also barriers. So Nigeria at the moment is just about either 51% or so in coverage of this birth dose vaccine. And that is a serious gap in preventing new infections of hepatitis B virus for us as a nation, Nigeria.
Well, if you have to screen blood for syphilis, hepatitis B, and HIV before transfusing, then hepatitis B is important enough to think about eliminating it. I want to quickly ask this question, Dr. Omotosho. How long does vaccine cover for hepatitis B last?
Thank you. I'll come back to the duration of the vaccines, but quickly let me add to what Dr. Ada said. When you're doing a program like the prevention of mother-to-child transmission, like we already have for HIV, that we should also have for hepatitis, it's important to actually consider three things. First, the primary prevention, then the prevention of unintended transmission. And that is the part that I want to bring in addition to preventing the vertical transmission when you already know that the mother has it. But for instance, if a lady was raped and now contracted hepatitis and she didn't know, and it's afterbirth, within 24 hours, there's what they call post-exposure prophylaxis. So they can quickly administer immunoglobulins to ensure that the child does not contract it. Now, returning to your question, it's absolutely sickening when you realize that there are vaccinations to prevent hepatitis B, for instance, and people are not coming forward, depending on the company manufacturing the vaccine. For some, they tell you 10, 20 years, but on the average, it will take 30 to 40 years. Now there is first, second, and third doses. The first dose is recommended by WHO to be taken immediately. You do the tests and you confirm that you're negative. Just get that first shot of the vaccine. 30 days later, within 30 and 45 days, you come for the second shot, and then there is a booster dose 1 month to 60 days after the first one. But so that for compliance, to increase compliance, we tell people within 30 days, so that it's 30, 30, 30. They can now take the third dose, and then you should be covered for 30 to 60 years.
Oh, wow. That's like life.
Yeah. That is, in fact, that's
I'm afraid that's all we can take, Dr. Omotosho.
Unfortunately, you can't even have an overdose.
Thank you, Dr. Omotosho, for being our guest today. Thank you, Dr. Prince Ada. Also, I had two great men in the house today. It's wonderful having you. Thank you, viewers at home. Enjoy the rest of your day. I am Mary Alale Yusuf.